Hi, I'm Corinne Marasco. I'm the Chair of Neurosurgery here at the University of Michigan. And what I'd like to talk to you about today is what happens after the baby is born. A child with spina bifida will have lifelong issues that will need to be addressed and followed up with doctors in a variety of subspecialties. In the first hours of life, a group of physicians, including the neonatologist and neurosurgeons, will assess a child in the intensive care unit. The neonatal intensive care unit is generally the place where such children are placed shortly after birth. It's that assessment which helps us decide when and how we're going to take care of the child in the first days of life. So after the baby is born, one of the most important things that we need to make certain of is what we do for all children, which is, are there any problems in terms of breathing? Are there any problems in terms of infection? Is their heart working well? And after we get through all of that, the vast majority of children will have no problems in that area. We then are particularly interested as to whether the baby will have the development of hydrocephalus. The repair of the myelomeningocele usually occurs within the first 24 to 48 hours, and the decision about whether any kind of diversionary procedure for the cerebral spinal fluid to deal with the hydrocephalus is something which also will be made within the first day or two of life. But in many cases, dealing with the hydrocephalus is something which needs to be followed over time and therefore may not be done at the same time as the repair of the myelomeningocele. After that, there are other additional things that need to be looked at. The doctors from urology and orthopedic surgery will examine the baby to make certain that the bladder and the bowel functions are okay, that there are no specific problems with how the legs are working or the spine. And the neurosurgeon will be particularly important to look at whether the baby has any additional problems that require neurosurgical intervention. If the baby has had a repair of the myelomeningocele in utero, then the neurosurgeon will be primarily looking at that repair site to make certain that it's okay and not having any problems. If the baby did not have a repair in utero, then that's something that will also be done in the first days of life. The timing of that will depend a little bit on each child. We need to make certain that the baby is safe for an anesthetic, and we also need to make certain that we often use our plastic surgery colleagues to help us make certain that there's adequate skin closure in these children. Over the lifetime of a baby, there will be necessary follow-up with each of the specialists I talked about. The neurosurgeon to make certain that the neurologic function continues and that there's no problem. The orthopedic surgeon to make certain that the spine, particularly with respect to scoliosis, and the lower extremities, particularly with respect to how they're formed and how the walking is going, and the urologist, because almost all children with spina bifida, particularly myelomeningocele, have problems with their bladder and bowel function that will require the urologist to follow them. Children with myelomeningocele require a multidisciplinary approach to their care. Because the life expectancy of a child with myelomeningocele is really quite good, and that we expect them to grow up to be adults and to have normal lives with respect to their disabilities, we also recognize that it's a lifetime process of working through multidisciplinary care to achieve the best results for these children. Therefore, it's a group of specialists who understand the complexity of myelomeningocele who will be taking care of the child, not only as an infant, but as a young adult and onwards into full adulthood.